I'm going to start with very good news for everybody. Last Tuesday, the scientist Stephen Hawking, who most of you know, he suffers ALS, announced that the system helps to communicate him with the outside world will be made available online in a move that could help millions of motor neuron disease sufferers. This is a very good news. The system, developed by Intel, reduced the number of moves needed to spell out words. The professor said, "Medicine has not been able to cure me, so I rely on technology to help me communicate and live." So the next project I'm going to present you is Ojos que Hablan. It's a project which is about communication as well and positive collaboration. So let me to introduce a video made by Argentinian ALS Association.
Bueno, mi nombre es Verónica Perdomo, soy modelo, conductora, actriz, soy sobreviviente del ACV. Hace 5 años tuve un ACV, estuve un mes en coma y cuando me desperté no podía caminar, no podía hablar, no podía hacer nada, estaba con pañales, estaba con tracotomía y mi única forma para hablar o comunicarse con la gente eran mis ojos. Ojos que hablan. Es el proyecto de dignidad e inclusión social que llena de orgullo a la Asociación ELA Argentina. El año pasado realizamos el abrazo solidario. Entre todos logramos comprar dispositivos oculares para personas con ELA. Adquirimos los mismos a la empresa española Iris Bon. Seleccionamos iniciativas de personas con ELA con espíritu y esperanza. Nuestra propuesta era facilitar un proyecto de vida cotidiano, un propósito creativo cada día. Le entregamos a Hernán Castro el dispositivo y esto pasó.
Hace 3 meses cumplí mi aniversario 9 con la ELA. Esclerosis lateral amiotrófica. La enfermedad fue de a poco y lentamente, privándome de mis actividades físicas básicas. Primero la motricidad para el desplazamiento, después la mecánica fina y por último, el habla y la deducción. En un estadio avanzado, la falla en el diafragma dio paso a los problemas respiratorios, acortando la brecha entre respiración espontánea y la asistida. En escasos 2 años no pude leer ni escribir libremente. Permanecí privado de mis hábitos favoritos, hasta la mágica aparición de Lisbon, que facilitó asombrosamente la terminación de mi segundo libro, titulado Similitudes y Antinomias. La autobiografía anterior, Las musas me visitan de madrugada, en la que detallo pormenorizadamente los alcances nefastos de la enfermedad, fue escrita mediante la tabla abecedárica, lo que demanda un tiempo excesivo y un desgaste demasiado extenuante para un elático. Ahora en posesión de Lisbon, que me permite no solo colaborar en el arduo trabajo de educar a mis hijas, sino interactuar permanentemente con ellas. Asimismo, asistir a fiestas y eventos, participando activamente en las conversaciones, y no pasar inadvertido ausente. Todo ello, sin requerir de un asistente ducho y hacedor de la tabla abecedárica, que pueda decodificar con exactitud las palabras que el enfermo marca con esmero. Es sumamente importante para el elático contar con esta herramienta informática para informarse e integrarse también a la sociedad de un modo inclusivo. Es a la vez práctico y satisfactorio para el desarrollo diario. Disponer de Internet facilitando la información a través de los periódicos o actos netamente recreativos, como acceso a vídeos o música, y también las comunicaciones vía redes sociales, nos mantienen muy próximos al mundo real. No depender de un asistente permanentemente. Recrea al discapacitado, reinsertándolo nuevamente al mundo de la civilización, devolviéndole de algún modo el don de la palabra. Sin duda es un elemento que me ha devuelto las esperanzas de creer que otra vida es posible, por más carencias físicas que a uno lo imposibiliten. Gracias.
So, how starts this project? The origin is in Argentina. You know, the Association of ALS in Argentina, they are very brave, very active on their institutional programs. They have the commitment to pushing all of them. And between the programs, there was one focus on providing real and effective communication to ALS patients. They have a problem. They don't have technology locally. On the other side, there was an emerging company in Spain who provides a high technology and very competitive eye tracking system to control the computer with the eyes. One of the benefits of these systems is that it provides remote installation ability through a remote platform, and a team which is really committed to build collaborative projects. So we got common interests and common needs, and we got a common language, but not talking about Spanish. We got the same target, we talk the same direction, and we try to build the same project. We build a project, a team based on trust. And with that, we decide between Asociación ELA Argentina, which is ALS, Argentinian Association, and Irisbon Company to build a common project to develop and to provide this kind of devices to ALS patients. So we build Ojos que Hablan, Eyes to Talk project. What is moreover the project? Beside the video you already saw, the project intends to provide to ALS patients in Argentina that needs an alternative communication way to provide eye tracking devices to facilitate an autonomous communication way. The association also provides legal support and advice to get these products granted by the Argentinian government. And finally, they provide also collaborative projects and inclusive projects to restore dignity to the patient. In the example we saw in the video, it was Hernán Castro, who is a lawyer. He has wrote a book within these devices. In 4 months, he was able to write a book, and the association pay a salary for that. So it's a very great dignity and social inclusion project. So what is behind that technology? Maybe more of you know about eye tracking technology, but who don't, eye tracking is a system based on a device that provides the ability to control the computer with the eyes. I will not go in detail about technology, but just some brief explanation. This is a device connected to the computer with some infrared lights that sends a beam to the cornea, and a video camera which records this information, this glint in the cornea, and sending this information to the computer. There in the computer there are some algorithms and programs who translates this eye movement into the mouse movement. In fact, we control the computer with the eyes. The ability of this technology also is that there is an online platform developed beneath that enables to remotely install any device in any place in the world. So we install more than 30 units in Argentina and control and support it from Spain. And basically, that is a very easy and intuitive system. Anybody can start from the beginning talking with the eyes. We also develop an auxiliary software, communication software, which is based on free software that enable the user to navigate or to control any application on the computer with the eyes. Let me say, writing documents, sending emails, surfing internet, why not using WhatsApp, which is very valuable nowadays for the users, and also includes a communicator that enables to the user to speak with the eyes. Let me now to introduce a small video that was shown in the first TV channel in Spain about ALS patient in Spain, in Sevilla. She's María José.
Si lo quiere hablar, lo habla, si no, se lee y ya está. Le pide si quiere un zumo, si quiere agua, si quiere de comer.
Mamá, para mañana esta es la ropa que se tienen que poner las niñas. Paula, una camiseta rosa, las mallas azul marino y los deportes.
So, as you can see with this device, with this technology, it's possible to improve the quality of life of people. And this is our main target. I mean, to make access the technology to the ALS patients in order to give them quality of life, but in a sustainable way. I mean, maintaining our perspective of the business. So, some of the projects that we are now pushing also, apart from the project that we have been collaborating with Argentina, we are also pushing some projects in Spain, trying to support the ALS associations in Spain to include this kind of devices in the national healthcare system. Actually, it's not included. A wheelchair is included in the national healthcare, but not a communication device. And for ALS patients, it is more important to communicate than move in a wheelchair. So we are supporting them. We already present to the ministry a proposal, a formal proposal. I know that also in Israel they are doing the same, and we are trying to work together. We also are trying to check in Europe how is the directive about that. But our intention is just to work all together in different countries to try to push the government to include this kind of devices. And finally, one project that we are also promoting with several associations is try to focus this kind of technology in order to make it accessible for most of the people, trying to engage other agents, let me say foundations or whatever, with a perspective of a social innovation way, and we trust that it is possible. Projects and experience as we had with Darío and Pablo, who is very valuable, and we got a very close relationships because we build a very, very social project. We really understand that this kind of projects, they are really sustainable. So we are pushing on that direction. Thank you very much.
Thank you, Eduardo. That's a fascinating presentation. I'm sure there's lots of questions around. So, hands, please. None again. Gosh. Go on at the front. Sally.
Hi, so I'm Sally. I'm from the Association in England, Wales and Northern Ireland. We have lots of difficulties in our three countries around the government providing eye gaze technology to people. It's very different across different parts of the three countries. So what I wonder is how you decide when the association, the Argentinian Association, will provide the device and when to encourage the government to do so.
Is because the user experience shows us that we have a very good technology in our hands, but we have the commitment to share this technology. So we cannot do it by ourselves as we are a company. We have to engage the associations because they are also interested on that. So in Spain, we are trying just to get a common effort between all the associations because we have several associations in several regions in Spain. So our intention is just to gather all of them with a common project and to present this kind of devices, not just only our system, but all of the system, all alternative communication systems. The recommendation of the ministry that we were last week with the director of the healthcare system was that we have to start step by step. I mean, if we want that all of the assistive communication devices be included into the healthcare system, we have first to start with one product. He recommended us that we could start with this product, and then we open the way for the other ones. So we just start with that. We know that in Europe there is a directive from 2007 related to this kind of devices. As you know, the directives of European Community, they are not mandatory for the governments. So we are trying just to engage also the government because of this directive and to include this kind of devices. For the ALS population, we are not talking about a huge amount of population. So it could be done, and it's not an effort for a government. I really trust that we in Spain, we are going to get it.
Okay, best of luck.
Thank you.
Further questions in the room? Yeah, at the back.
David Oliver, a consultant in palliative medicine in the UK. I just wondered how often you saw patients with cognitive change, as we were hearing about in the previous session, when they cannot or find it very difficult to use eye gaze because of cognitive change.
Mm-hmm. Yes, you're right. Technology is there, and it's proven technology, and it's tested. We have more than 100 units working around the world. But it's true that it depends on the patient as well. I mean, you could not force a user to use this kind of device, although this is a very good device and could benefit his communication. But you have to rely on his experience. According to our policy, we gave the possibility to the user to test during a period of time, and if he doesn't agree with the, or he doesn't fit with the technology, so he could send back the equipment, no problem. But
do you ever find people misuse it? We had a patient who sent emails to all her friends and onto Facebook saying how awful we were and how her family didn't visit and how awful the family were. This would be 5 minutes after they'd visited.
Sorry, I didn't tell you.
So do you have people who misuse or use Facebook when they have cognitive change, which actually can be harmful for their family?
Yeah, I mean, we have experience of users that they were isolated completely. They were not in the social networks, and they start again writing the blogs, the social networks. They connect together. We rely also in the communication with our users. I mean, depends on the user, of course, but we have some of users in Argentina, in Spain, and wherever, that are real committed to improve the technology. And so we connect together, and they send us feedbacks about the user experience in order us to adapt our programs and our technology to be more suitable for the use.
One last question at the back.
Hi, I'm Malabika Ghosh. I work at the Lancashire Teaching Hospitals in the UK. I deal with a lot of patients who have cognitive impairment, and I foresee one of the issues that might be, that might impair the use of eye gaze technology is attention impairment, because you need sustained attention over periods of time to be able to use this technology. So this, along with the cognitive change, the earlier speaker was referring to, I think might be the two issues that need to be supported when patients use eye gaze technology. Just a comment, really.
Yeah, if I talk your question, is of course the user. I mean, to control a computer with the eyes is not a common task, so the user has to be used to. We decide from the beginning that beneath this technology has to be an interface, a really easy, user-friendly interface that anybody could use the technology. So actually, in fact, I could explain our experiences that once a user receives the equipment and he starts working, we connect with him through internet, we install in 1 hour time, moreover, it takes to install and to start working, and in less than 1 hour, the user is starting to talk with the eyes. So the user experience is really good in most of the time. Could be that some of the users are not used to. Also, it depends of how is the ability of the user, and sometimes also the eyelids that should be open, of course. So there are many questions that you have to take into account. But regarding to our experience, if the user is committed to talk and to start communicating with the world, this is a really good tool.
So have you done any studies to look at this? How many users are able to use? How many users need extra support to be able to learn? Because this is new learning for them, and cognitive change will impair new learning in these patients. So have you had any studies to prove?
We didn't. We start a company last year, and we already have installed around 100 units on the market. The study we did is the user experience, and I can tell you that from the user experience is that we have not special drawbacks about the using technology. They have to train, of course, and as much as they train, the better experience is, but we have not any official study.
Okay, thank you.
Welcome.
Okay, join with me please in thanking Eduardo for that presentation. Thank you.